Thank you, Elsa.
Oh, you missed that great introductions. And again, I want to apologize because we have so many participants that if we went through the whole list and had everybody introduce themselves, unfortunately, that would take up the whole hour. So forgive me for that. I do want to introduce Sarah Smith for those who don't know you, who's providing my technical assistance. She's indispensable. And also my colleague Kathy Hatch, who has joined. She's not on video, but Kathy works with me in the advocacy field. So I want to thank them for joining us too and acknowledge them. So what are the legal rights? As I mentioned, the ADA is the strongest piece of legislation that, excuse me, provides the protections for people with disabilities, not only in employment, but in those other areas I had mentioned also. And the EEOC is the group that, the organization that enforces the ADA to make sure people are compliant, employers are compliant with the ADA. And if you decided to go to the legal route and file a complaint, it's through EEOC that you would do that. Many people with epilepsy are able to work and are successful carrying out their job duties. Having an occasional or even fairly frequent seizures may make your job hunt more challenging, undoubtedly, but not impossible. Keep in mind, the better qualified you are for the job you're applying for, the better your chances are. But that doesn't change the fact that there's still a lot of myths around seizures, and discrimination can make you reluctant to tell your employer about epilepsy. So your legal rights, again, these are the laws and the agencies that offer you your most protection. Thank heaven for Google, because otherwise you'd be looking at slides with a bunch of links that you wouldn't have access to just looking here. So if you want to know about the EEOC, the Equal Employment Opportunity Commission, or if you want to actually file a complaint with against your employer, again, you would go to the EEOC. I could fill up pages of information on the EEOC, but my recommendation for tonight is Google EEOC, and it will take you right to that agency website to find out what they do. But also there's a quite easy process if you decide to file a complaint. Now, if you do decide to file a complaint, it has to be done in a timely manner. You can't go back 3 years and say, oh, I remember when I worked at CVS and this happened, I want to file a complaint. You have to do it in a timely manner, typically within a month. Now, at the state level, sometimes people have just basic questions about their rights in any given state. So if you live in Maine, just Google Disability Rights Maine. If you're in Vermont, just Google Disability Rights Vermont, and it will take you to the state agency that can help you file a complaint. But also, they're just a wonderful resource to ask questions like, can an employer do this? Or do I have this right? So again, thank heavens for Google, and you can go back and find these resources if and when you would need them. Okay. If you decide to talk about your epilepsy, I'm trying to keep track of my own slides here. If you do decide, it's your, first of all, it's your choice. Remember, practice with somebody. If you're going to talk to your employer or a coworker about your epilepsy, the more confident and well-informed and relaxed you can be, the more reassured the employer or your colleagues are going to be. So practice. You want to talk about your epilepsy. If I have a seizure, this is what will happen. This is what you can do. so that they're well informed about your epilepsy. Because as we know, people think of epilepsy all too common. They just think that someone's going to fall down and have convulsive seizures. So tailor your conversation to what your epilepsy is and what your seizures are. Okay. And if you do decide to disclose your epilepsy, it's up to you. An employer cannot ask you about your epilepsy, except in very rare situations, until a job offer has been made. So some people want to go in and disclose their epilepsy right up front. And that, again, is your choice. But I can't think of one job where epilepsy is a requirement for that job. So you want to keep the emphasis on that job and sell yourself for that job. At some point, if you feel for safety reasons or whatever, you want to disclose your epilepsy, again, that's up to you. But I would not recommend doing that in the initial interview or until a job offer has been made. Okay. If you do decide to disclose your epilepsy early on, be prepared. And some of the topics you may want to talk about are how long you've had epilepsy and how well controlled it is. Again, they're interested in your seizure disorder, not epilepsy in general. If you drive, say so. Say how long you've been seizure-free. Explain that research studies show that the longer people are free of seizures, the greater the likelihood that they're going to be seizure-free. Now, if you've been seizure-free for a very, very, very long time, and you're well qualified for this job, there's probably very little reason for you to disclose or discuss your epilepsy. But again, that would be your personal choice. If you've never had a convulsive seizure in your life, mention that as well, because remember, the average person thinks everyone with epilepsy has convulsions all the time. That just is part of the stigma, unfortunately, still associated with epilepsy. If you only have occasional seizures, point that out too. Explain that if one should occur, it will only last a few seconds, and you might want to then describe what would happen during a seizure and what someone could do. And always explain how this condition is actually affect your ability to perform a job. Remember too, that studies show that people who have acquired good job skills, basically qualified for that job, that is what you want to emphasize during your interview, especially your initial interview. Okay, safety issues and concerns. Undoubtedly, this does come up, and along with medical exams, and what role can and should your physician do to help you get this job? Employers often raise safety concerns and may try to exclude people with epilepsy from jobs involving public safety. It may be useful to point out that people with epilepsy, the majority, can be safely licensed to drive. So if they can be safely licensed to drive, then the state has said you're not a public safety. Under the ADA, employers can't exclude people with epilepsy or any disability unless there's specific medical documentation reflecting current medical knowledge that the individual would pose a direct threat. They need to rely upon current and accurate medical. They just can't assume that because you have epilepsy that it's going to be a threat. And medical exams, I just want to make sure I get this right. Under the ADA, the Americans with Disabilities Act, prior to the offer of a job, they have to offer you the job. An employer may not ask whether an applicant has a disability, or they can't ask about the severity of it. They're permitted to inquire whether an applicant can perform the job-related functions. And that's why it's very important to actually have a copy of the job description, if possible, and a clear understanding of what this job is asking you to do. Excuse me. An applicant who believes that an applicant satisfies the requirements may offer the applicant a job initially based upon the satisfactory outcome of a medical exam. So the key point there is they can only ask for a medical exam once a job offer has been made. And if they request a medical exam, they have to require that of all the job applicants. And your physician's role, again, they may ask for medical evidence, once a job offer has been made, or you're on the job, or there's something suspect comes up in the medical exam. And your physician's role can be very important, because they oftentimes will write a letter actually stating, there's no reason why you can't have this job. The employer cannot ask for all your medical records. They can only ask for anything from your doctor that is related to the job that you're performing. And oftentimes that can be confusing. So if anybody has a question about that, I think we could address it now. If you have any questions, if you want to put it in the chat or raise your hand. Okay, so the other point to remember, if a job offer is withdrawn because the results of an exam, a medical examination, the employer must show how the medical examination applied to your particular offer. And drug testing, they can only test for the drugs you're on for medical reasons or for substance abuse. So an employer does have the right to test for certain illegal drugs. Again, having a discussion with your doctor, what they write can be very important in terms of reasonable accommodations. So they may write, John or Mrs. Jones is very qualified for this job. The only reasonable accommodation we're requesting is to not work around flashing lights, or to allow for a brief rest period if they do have a seizure. But the doctor's information, again, can only be job related to the job that they've offered you. And the reasonable accommodation can be, your doctor can play a strong role in requesting that. So don't rule out them as your ally in your job search.
Hey, Bill.
Yes.
There's a question in the chat asking, why is it suggested to disclose your medical history and medical background in the interview process and not until after being hired?
Say that again.
Why is it suggested to disclose your medical history and medical background in the interview process and not until after being hired? So I think they're asking why not in the interview process.
Okay, well, again, the initial, first of all, it's completely your choice. We respect the individual's choice. If someone, let's say, has frequent seizures and they feel, oh, my employer should know that up front, that is their choice. But our recommendation, and again, I'm not a lawyer, our recommendation is the initial interview is to sell you based on your qualifications for the job you're being interviewed for. And as I said, I'm not aware of epilepsy being a qualification for any job. And the other thing is, if it does become a legal matter, so let's say you disclose it in your initial interview, and then they don't offer you the job. you'll never know if they didn't offer it to you because you had epilepsy or whatever. But if they offer you a job and then they take the job offer away once they find out you have epilepsy, that can be clear discrimination if they're not willing to provide a reasonable accommodation if that's not needed. So does that answer the question? But that is a common question. But the other thing is, if they make you a job offer and then take it back because they find out you have epilepsy, that can be clear discrimination. If you disclose it before the job offer and they say, no, the job's not yours, you'll never really know if epilepsy came into play in that decision. Good. So I think, I see we have 22 comments in the chats. Are there any other questions there, Sarah or Kathy, that you see?
There is one asking if you can address service animals. I did ask for a little more
Service animals?
yeah, disclosure in relation to reasonable accommodations.
Okay, we're going to talk about reasonable accommodations in a couple minutes. And if I don't address that topic, then we can go back to it. So if you can just be patient and wait till we get to that section. But a blanket statement about service animals, if it's a seizure dog, and that's considered a service animals have to be allowed into any public space. So, guide dogs, seizure dogs, they have to be allowed into any public space or job. Again, if they don't allow them, it's discrimination. Now, there's a gray area around emotional support dogs. And I have to be honest, I don't know where that stands legally at this point. I think there's a lot of pending cases around that. But again, I'm not a lawyer, so I can't say with certain. But seizure dogs and guide dogs for the blind, et cetera, have to be allowed into any public spaces. Mm-hmm. Okay, reasonable accommodation. This is probably what we get the most calls about. Someone has had a seizure on the job and the employer's freaking out, or or their colleagues have a lot of questions what to do. So you've got the job offer, you're qualified for the job, you can do the basic functions of that job. And again, that's why we highly recommend that you have a copy of the job description. And also, if you're offered a job and you take the job, have in hand a copy of the personnel policies or the employee manual. I was helping someone with a situation just the other day, and I said, well, what does the employer manual say about leave time? And the person wasn't quite sure. And so always get a copy. It may be online, maybe a hard copy, but always have a copy of the employee manual so you know what your benefits are and what your protections are. A lot of times things happen based on misunderstandings, and it goes right to HR, and everybody's up in arms and confused. And we go and look at the employer manual, is that the person didn't go through the process of like talking to their supervisor first, or if the supervisor's the problem, with talking to that supervisor's supervisor. So it's important, two things: to know the job you're applying for, what the job description is, and also once you are hired, to get and keep a copy of the personnel policies to make sure that they're following their own policies. So an employer must make a reasonable accommodation. Now, keep in mind, if you are not qualified for the job and they don't hire you, it's probably because you don't meet the basic requirements. You have to meet the basic requirements and be able to do the basic functions of the job. So they must make a reasonable accommodation for a known disability, unless to do so would impose an undue burden on the employer. Now that's legal talk. Whether a particular accommodation imposes an undue burden depends on a number of factors. So that's a very vague legal term, an undue burden. So, if you need to look at the overall size of the employer. How many employees do they have? If it's IBM, they can well afford a reasonable accommodation, let's say to build a ramp or an access issue, more than a company that employs 6 people. So it depends on the overall size of the employer, the number of employees, as I said. Now, remember, this only applies to companies with 15 employees or more, not to every mom and pop shop. The number and types of facilities, is this a one-room operation, or is it in a big office building, or is it a large factory? So these are the considerations that that come into play when you're talking about a reasonable accommodation. The budget size, a multi-billion-dollar company has more resources and ability to provide reasonable accommodations than a $50,000 operation. And the nature and the cost of the accommodations requested. Most accommodations related to epilepsy, and I'm talking in general terms because it always comes down to the individual, the cost of the accommodations are minimal. Give the person a few minutes to rest after a seizure is not going to break the bank. Providing a blue screen or whatever, I can't remember the name, the cover to put over a computer monitor to reduce the glare for those who are photosensitive. Again, those are not going to break the bank.
Bill, I have
Yes.
a question. What if a potential employer is asking for a signed release of information in order for a job application to be submitted?
Huh? Can you repeat that?
Yeah. Sorry, I scrolled down.
A release of information regarding what?
What if a potential, Ally asked the question. If you'd like to come off mute, feel free to.
Sure. I just had one today that was assigned. Yeah, in order for me to submit the application, it said authorization to release information, and in it said, I hereby request and authorize you to furnish this employer with blah 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 blah, including past or present medical conditions.
Um,
And I couldn't even submit the application without.
Is this a large company?
No, it's the town I live in. It's the town of Wyndham is what it's called. So
The town is asking for medical records?
Mm-hmm.
Um,
Has anyone else had that before?
I mean, we've heard it, and this is where a delicate balance, because if you call and say you can't ask that, then everybody gets defensive, correct? And do they give you boxes to check?
No, it was just this printout form. And in order for me to sign it, in order for you to submit it, I had to sign at the bottom. And I didn't want to do that. So maybe just don't apply to those types of jobs.
No, nobody can ask you any medical history. It's illegal on a job. The ADA, doesn't just protect you when you're on the job. It's the whole process. The ADA applies to the application process, So let's say a blind person's applying for a job. They have to give the application available in an accessible format. The ADA protects you on the job, and the ADA protects you in terms of like benefits. So let's say, employers used to always say, we haven't heard this in a long time. Oh, my health insurance is going to go up if I hire a person with epilepsy. That's not true. So they can't change, the application process has to be accessible, the job, during the job, and all the benefits have to be equal. They can't offer benefits, different benefits, saying, well, we'll offer you, the same vacation time and everything, but not the same insurance. That's illegal. I'm a bit surprised. So it just says you're signing away that they can contact and get your medical records.
That's how I read it. I basically copied it and crossed out the words I didn't like.
Right. And
Before signing.
And then how do you submit this? Do you mail it to them, or is it online?
Online, yeah. Everything's online these days.
Right, exactly. Is there any way for you to next to where it says medical records, just type in NA, not applicable?
Yeah, I'll try that. Thank you.
Right.
But you confirmed that it's basically not allowed. Is that what you're saying, for them to do this?
Right.
Okay.
So now this is a real life situation, right? So now you send that in. Does that raise red flags? I'm playing devil's advocate here, but this is oftentimes what it comes down to. Does it well, everybody else signed it except this woman? Why? They're breaking the law, but do you feel qualified for the job?
Yeah.
Okay.
It's director of finance for the town.
Right. So I would go ahead and send that in, and request an initial interview, and then sell yourself as the most qualified candidate. And then if you feel you need or want to disclose your epilepsy, that's totally up to you. But our recommendation is don't do it until they make you a job offer. Now, on the other side of that, behind the scenes, I'd be very interested to see that application. And I have no qualms about calling them and saying, why is this on your town?
All right, I'll send it to you. I got your email at the beginning.
Okay.
Thanks.
Because, not only do we try our best to help individuals, we tried when we can to sort of change the system. They should not, they should know, as a personnel office for a town, that you can't ask that kind of question. So, okay.
Ally, what's sorry to interrupt, Bill. What state is that?
I'm in Maine.
You're in Maine, right? Right.
Well, the other thing is, before the ADA, individual states had some protections in place, but the ADA now is a federal law, so it's irregardless of the state.
Bill, I have another question.
Okay.
What if you have to call in sick due to post-seizure symptoms on way to work? Employer is left in a bad situation, but it can't be helped on your end either. Does employer have right to let you go due to not showing up to your shift?
Well, that's why it's very important to have your personnel policies. What kind of sick leave do you get? What kind of vacation time you can use, your time off? That's why it's important. So, and again, it's so individualized. It comes down to what the job is, if that makes sense. But most jobs, people are entitled to some kind of sick leave, What happens in an emergency? Those jobs can vary from, okay, if you don't come in, you don't get paid today, or, oh, you don't come in, you've got 7 sick days, or you got 5 vacation days, you can assign it to that time. And this is where it gets tricky because it's so individualized. Are you the only employee? So, I don't know who asked that, but if they want to, again, email me specific, this is why, these situations are always difficult to do a general discussion because it so much depends on the individual and the job you're talking about. I hope I don't sound like I'm passing the buck, but it really comes down to the individual and that particular job. I don't know how much they want to share on this call, but certainly have them follow up with me and we can discuss it. Any other questions?
Checking. There was a response to you saying that she will email you and thank you for the offer.
Okay.
I don't see any right now.
Okay.
I'll interrupt you if I need to.
Fine. I also want to be aware of everyone's time. I know well, we got a few minutes left. So some typical reasonable accommodations. Now, I always encourage people, think about the job you're talking about, not just across the board, because there's so many factors that come into play. Job restructuring. So a person with epilepsy is working in a warehouse and they're having active seizures. And it requires, like these days, if you're working for Amazon, it requires you to climb a ladder and get the stuff down. But climbing ladder isn't particularly safe in your individual situation. Could they restructure the job so that someone else does the climbing the ladder and you'll pick up something, some other task that person does? So that's just a sample of job restructuring. And we've seen that work. Extra breaks. I don't like to say extra breaks, more just some recovery time. If you do have a seizure, a reasonable accommodation would be like, I just need 10 minutes to rest after a seizure, then I can get back to the job. Now, they have every right to say, okay, but you're going to use, if you get an hour for lunch, we're going to take that 15 minutes off your lunch. They do have the right to do that, within reason. So extra breaks related to your seizure disorder. It can't be just because you want some more time during a coffee break. Modified schedules. So in this day and age, it's a little easier to request this because so many people are working virtually or a hybrid situation. So a lot of people with epilepsy, because of their medications, it's hard to get up and get going first thing. So a modified schedule is, okay, instead of being on the 7 to 4 shift, could I come in on the, 9 to 6 or 10 to whatever? So modified schedules is a reasonable accommodation. Assistive devices. For epilepsy itself, I don't think there's too many assistive devices, but other than related oftentimes to technology and lighting, just the proper kind of screen or dimly lit work environment. Changes in the workplace. Again, that's relates to more the environment, like the lighting, the sounds, any kind of stimuli that may trigger a seizure. And then the leave, I may have to take time off for medical reasons to address my seizure disorder. So again, this comes back to having your handbook, knowing your policies. I'm going in for epilepsy surgery. Do I have a leave for that and guaranteed job when I get back? And again, in this short amount of time, it's difficult to answer everybody's individual situation, but these are common reasonable accommodations. Now, the other thing to keep in mind is you have to request the reasonable accommodation. And that's really beneficial, because we don't want employers across the board saying, oh, we have to provide a reasonable accommodation to people with epilepsy, and just put in general kinds of accommodations. They need to be tailored to what you need. We don't want employers thinking, oh, this is what I bet people with epilepsy need as a reasonable accommodation. And this is where your doctor can play a key part. Ask for a reasonable accommodation. You have to request it. And you have to be very specific about what you want. You can't just go in and say, I want a reasonable accommodation. And they're like, huh? What do you mean? What? You have to be very specific about what you want. And if it's reasonable, they have to provide that. But keep in mind, reasonable versus unreasonable. If you say, I want you to build me a new house, that's not reasonable. But if you're saying, I just need 5 minutes to rest after a seizure, or I just need a screen to protect the glare on my laptop because it could trigger a seizure, those are reasonable. Again, contact me. There's my email address. And the folks who spoke up, I'm going to look forward to getting your emails and getting back to you. And are there any other questions? I see there's 60 comments in the chat. I don't know if we can get to 60 questions. Any other questions you're coming across, Sarah?
I've been asking a lot of questions. There's some comments and stuff and conversations.
Could I ask you another quick question, Bill?
Yes.
Have you ever heard of a reasonable accommodation related to memory problems as a side effect from both my seizures and my medications I'm on because of the seizures?
Yes. And again, it depends upon the job. But a common one for people with memory issues is, if you're at a meeting, can I tape it? Can I tape the meeting so I can go back and review it? Some folks ask for a little bit more time to do some paperwork. They need a little more time to write a report. A student in school may request a little more time to take a test. But one of the common ones is, okay, for meetings, could I tape them and play them back to make sure that I'm getting all the information down correctly? Does that answer your question?
It does. Thank you.
And the other thing is, I encourage people, okay, what you know best, what would help you? You got the basic qualifications for the job. You can do the job. What reasonable accommodation will enable you to do the basic functions? Remember, they have to be considered on a case by case, with emphasis on your own individual needs. And there's no blanket accommodations that would be appropriate for everybody with epilepsy. And sitting down and talking with somebody, or just reviewing the job and having a conversation with yourself, what do I need that will enable me to do the job? The other thing is the Job Accommodation Network. Again, thanks for Google. They are a wonderful source of free information, guidance on workplace accommodations. So just Google Job Accommodations Network. I don't know if I can even add that while I'm using this slide, but again, reach out to me if you want more information on the Job Accommodations Network. Again, the EEOC, I encourage people, I always emphasize, you have the right. These are your rights. That's why these laws and these protections are in place. But the legal process can be long. It can take time. So ask yourself, what's the outcome I want? If I want to save my job, then I would, use every resource available, the foundation, the Disability Law Center, to arm yourself with, are they following their own policies, the company? Have they provided reasonable accommodation? Or is your intent, like, I'm leaving this job because they discriminated against me and I'm going to file a complaint against them so they don't do it to anyone else? So again, it's your choice. But I know many people want to stay on the job. And so that would require more advocacy on your part. But there's resources to help you with that. The foundation, the Job Accommodations Network. So it really depends on what outcome you want.
Bill, so Alex is here from Epilepsy Foundation. Help me out, Alex.
Hi, Sarah. I'm from the Epilepsy Foundation of Greater Chicago. I just popped a question in the chat of how and or if does your location offer job advocacy to employers, the organization? What does your process look like from your side of things?
We do employer education. We have a staff person, Christine Benet, who does all of our community and professional education programs. She and Amy Lopez and volunteers. But we've done everything from, I know I've gone with individuals. We don't have the resources to do it for everybody, unfortunately, but there are other community resources we can refer people to. We do general employer. We go and do employer education for the whole staff of a company, say. And those are very well received. Now, if we're doing a whole training for a company, we're not going to go in and talk about one individual. Oftentimes that individual will stand up and say, I have epilepsy. But we also, I hate to say it, but we have to do it on a case by case, that we can go in and sit down. Now, the other thing is the national office has the Jeannie Carpenter Legal Defense Fund. And people can apply for that, and they just go through the national website and send in a brief form saying what the situation is and asking for help. Now, they don't represent individuals, but if an individual is in the middle of a discrimination case, they can work with their lawyer and things like that. Does that answer your question, Alex?
It does. Thank you. I'd be more than happy to connect offline on another time as well, too.
Okay. Now, most of the calls we get are, and again, these are most, everything's an individual situation. So I know I speak with a lot of individuals, and we can make recommendations. Again, we don't offer legal and medical advice. If the person's trying to correct a situation at their current job or save their job. Once they say, I want to file a lawsuit, then we have to refer them to EEOC or the state agency. All right. Thanks. Another topic that comes up sometimes is I hate my job. I want to get out of here. I'm leaving. And I just want to find a new job. And I want to encourage people, if they are going to look for a new job, just to encourage them to look at what the benefits are of that job. If you're living with a chronic disorder, you may need to double check, does the new job offer healthcare coverage? And what does that coverage include? The healthcare system and insurance companies have made it very difficult to know what they cover, what they don't cover. So I just like to caution people, lots of new great opportunities come, but if you need specific things to be covered, double check that policy. I encourage people to advance themselves and look for new jobs. But that's the one red flag that oftentimes come up. And I just want to encourage people to check the benefits and do they meet your needs? I can go on and on about reasonable accommodations and disclosure and everything. As I said, people spend years getting degrees in disability law. So this is basically just an overview of the ADA, what it provides. So any other questions or comments? Feel free to jump in. We got 3 minutes. So, well, hopefully everyone was able to get my email address. If you have any comments or questions or concerns, please feel free to email me. I'll be very interested to see that town's application.
Bill, I put your email in the chat a few times already,
Okay.
and
What
your
about-
title and everything about you. That's great.
I'm sorry?
I said, and everything about you. That's great.
Oh, okay. Yeah. I'll send you the bribe money for saying it.
Never.
Well, Sarah, thanks for all your help with the technology. I could never do it on my own, ever.
You're welcome.
And keep the foundation in mind as a resource. We do more than just advocacy. And feel free to reach out to me. Kathy, I don't know if you wanted to add anything, or Sarah, or anybody on the call.
The only thing I was just typing it out, is that Bill Murphy is an invaluable resource for us all. So I wouldn't, and also one of the nicest people I have ever met. So if you do have extra questions, please don't hesitate to reach out to him. If you didn't get his email, is it on there again?
You can look me up online.
But you can look him
I
up
can
online.
put it back in the chat again.
That would be great, Sarah. Thank you.
Yeah.
And he can find anything and knows just everyone there is to know, and knows every resource there is. So if you have any question, and as far as people are getting into the schools, we do try to reach the schools. They're important to reach down to the young people as well. If we don't get a response from them, we will try to get to the clubs in the schools, in the colleges, and to the school nurses, because it's important. I never disclosed. I had my first seizure at 19 years old and never disclosed to anyone for 30 years because of the stigma. So we're trying to change that. I did things the wrong way, and I don't want anyone else to go through that. So Bill, thank you so much.
Thank you. If anybody else comes across any of these applications that ask for all your medical records, bring it to my attention. That one really got my goat. So
Yeah, me too. Me too. That got my attention as well.
I'm hitting send, Bill.
I just also wanted to mention that we have quite a few CHWs on here. So for any of you that do need help, and haven't been working with the CHW, it's a great opportunity. I can list a few of them. Esme is here, Elsa's here, AJ, Charlene, Emma, Maddie. I hope I don't miss anyone. Nitesh, are all here and are eager to help any of you that are looking for help. They can fill in the gaps, get in touch with Bill and help with a lot of their researching and tiresome work of trying to get answers that
I know we're running over time, and if people have to leave, that's fine. I don't like to keep people over time, but I'm scrolling through, what's the definition of a service dog? The Epilepsy Foundation, epilepsy.com, the National Epilepsy Foundation, you can go to their website and under the search, type in service dogs, and they will get, there's a whole bunch of information on service dogs. So I will look at these comments, and if I think of anything, I'll reach out to people if they don't reach out to me. Okay? Okay. So enjoy your evening. Thanks for joining.
Thank you, Bill.
Thank you. Sarah,
you.
can I stay on just to review the chat?